Now let's move to the fourth and final section of the lecture, ENT surgery, and in this we will talk about the procedure known as the proof puncture. We will discuss the indications of the proof puncture, anesthesia used, and the position of the patient when the proof puncture is performed, the technique and diagnosis of antral pathology, post-operative care, and complications of the proof puncture. So proof puncture is also known as the antral lavage. So antral lavage is the proof puncture. Puncturing the medial wall of maxillary sinus, the antrum, in the region of inferior meatus and irrigating the maxillary sinus is the procedure known as proof puncture or the antral lavage. Contraindications of this procedure, we have acute maxillary sinusitis for fear of osteomyelitis. So in patients who have maxillary sinusitis, this should be avoided because it can cause osteomyelitis of the maxillary sinus. The indications of the proof puncture are chronic and subacute maxillary sinusitis, confirming the diagnosis, washing out the pus that is present as a result of sinusitis, to collect the specimen of antral contents for culture and sensitivity, cytological examination to exclude early malignancy. So all these are the indications of antral lavage or proof puncture, in which we can remove the specimen from the maxillary sinus to look for any complication that is present, to exclude any malignancy that can be present by looking and taking the cells for the examination, also to collect the specimen for culture and sensitivity, and as a therapeutic indication to remove the pus that is present, to wash out the pus that is present in the maxillary sinus. So all these are the indications which can be therapeutic indications and diagnostic indications of the proof puncture. Next, the anesthesia used for the procedure and what's the position of the patient. Adults, the local anesthesia is the preferred anesthesia. A pack of 4% lignocaine with adrenaline in inferior meatus for 10 to 15 minutes is applied. In children, general anesthesia is preferred. Children are not very cooperative, so general anesthesia is preferred. Middle meatus decongested to open maxillary ostium. Local anesthesia is given in the sitting position. That's the position in which the local anesthesia is given. General anesthesia is in tonsillectomy position. The technique of the proof puncture, the lateral wall of inferior meatus punctured with liquids, trocar and cannula. So with the trocar and cannula, the inferior meatus is punctured. At a point 1.5 to 2 centimeter from anterior end of inferior turbinate and near attachment of concha with lateral wall. Trocar and cannula directed towards the homolateral ear. Nasoantral wall pierced with a crack. Remove trocar and advance cannula till it reaches the opposite antral wall and then withdraw a little. Antrum irrigated with normal saline at 37 degrees centigrade with the 20 ml or Higginson syringe. Syringing continued till return is clear. So for any lavage, like the ear lavage, we should do the process of lavaging until the fluid that comes back is clear. Until all the pus is removed, we should continue the procedure. After puncture is over, cannula is removed and a pack kept in the inferior meatus to control any bleeding that is present. Diagnosis of antral pathology. Presence of antral cyst, we can also perform the lavage. This thin amber colored fluid flowing from cannula immediately on puncture and containing cholesterol crystals, that's the indication of the presence of antral cysts. Hyperplastic sinusitis. Blobs of mucopus in the washings are present, and suppuration, if it is present, shows presence of foul-smelling pus, which easily mixes with irrigating fluid, indicates antral wash may be repeated once or twice a week. So all these are the conditions in which we can use the antral lavage to find out the antral pathology. Post-operative care, pack remove after about an hour. Antibiotics given for 5 to 6 days in case of suppuration. Nasal decongestant drops used to improve patency of the ostium. Analgesics for headache or post-operative pain if it is present. That's the symptomatic treatment. Just treat the symptoms which are present so the patient should feel better. Complications are swelling of the cheek. You can see there's the complication, swelling of the cheek. There is redness of the eye also. Orbital injury and cellulitis. Puncture of posterior antral wall if we go deep. Air embolism can also occur. So that concludes our topic of ear surgery, in which we perform ENT surgery, in which we talked about the surgeries like cryosurgery, then we talked about the myringotomy, myringoplasty, and then the proof puncture or the antral lavage. Thank you for watching sqadia.com.